Hello, and welcome to your 2021 new employee orientation for your health and flexible benefits. I am Monique Horton, the benefits coordinator with GDOT, and I will be going over your plan options. As we all know, the Affordable Care Act was passed to make sure that employers were offering affordable health care to their employees. Through SHBP, GDOT is in compliance. However, starting 2019, there is a $0 penalty for not having your health insurance for the tax year. All benefits are effective 30 days after employment. So if you start on the 1st of the month, your benefits go in effect the 1st of the next month. However, if you start on the 16th of the month, your benefits will not go into effect the month after that. So if your first deduction will be on the 24th of the month, if you have a deduction on the 24th of September, that means your benefits go into effect on October 1. However, if you have your first health deduction on October 24th, that means your health insurance does not go into effect until November 1. To make your online elections for your health benefits, please visit myshbpga.adp.com. Since you are a first-time user, you will need the one-time registration code of SHBP-GA. There is a new look to the health insurance website. If you have any questions, please feel free to give me a call. SHBP has implemented a member services email. This is a quick and secure way for members to contact SHBP. It is a secure email, and the responses will only be sent to the email on your SHBP portal. Your 2021 health insurance plans are Anthem, HMO, and HRA, Kaiser Regional HMO, where you must live or work within the 27 Metro Atlanta counties, United Healthcare HMO, and HDHP. There are telemedicine and virtual visit options for all plans. For Anthem, you would download the Live Health app and have a virtual visit with the doctor. You will not be charged any copays or any yes.
I see in there it says visit in 2020.
Oh, thank you.
Yep. Teamwork.
Yes, makes the dream work. Okay. SHBP has partnered with entities to have, no, don't want to say that. SHBP provides access to your physicians through telemedicine or virtual visits. For the 2021 plan year, Anthem has partnered with Live Health, where you can have a virtual visit. You would input all of your personal information, your insurance information, and copay if necessary. You will not be charged a copay until you actually have the visit with the physician. They have the ability to send in a prescription to your preferred pharmacy, as well as send in a work or school excuse. Kaiser is partnering with KP Now. You will have a telemedicine visit with a nurse. If at that time it is deemed that you need to be seen by a physician, they will make you an appointment. United Healthcare has partnered with United Healthcare Help for Me app. It works just like the Anthem Live Health app. You will put in all of your personal information, your insurance information, and copay if applicable. You will not be charged for any services unless you see the physician. If you decide to partner with Anthem and United Healthcare, please contact them and inquire about their co-insurance waivers for chronic illnesses. A few terms and conditions and definitions that I often get. What is a copay? A copay is a flat fee in which you would pay before you are seen by the physician. Co-insurance is the portion that you will be responsible for after your deductible has been met. A deductible is the amount that you are responsible for before the insurance starts paying its portion. Out-of-pocket max is the maximum amount that you will spend out of pocket towards medical, deductible, copays, co-insurance, and pharmacy costs. After out-of-pocket max are met, the insurance plan will cover at 100% for the remainder of the year. Eligible expenses are expenses covered under your health plan. A primary care physician is a doctor who would have a study and field as for family medicine, general practitioner, internist, obstetrician, or pediatrician. A specialist is a doctor that specializes in a certain field, like an endocrinologist or an ear, nose, and throat doctor. In-network providers are providers who have agreed to negotiated rates. Out-of-network providers are providers that have not agreed to negotiated rates and may not accept your insurance. However, you will be subject to paying a higher cost. A quick tutorial on how to choose a plan. So for the statewide HMO, which is Anthem and United Healthcare, you have access to providers nationwide. Copays are associated with certain services. Copays count towards your out-of-pocket max, however, do not count towards your deductible. And you have access to in-network providers only, except for emergency care. The regional HMO, which is Kaiser, it is a copay only option. There are no deductibles or co-insurance associated. All of your medical, pharmacy, and wellness visits will be done under the Kaiser roof. However, they do have a higher out-of-pocket max, and you must live or work within the 27 metro Atlanta counties. HRA, which is administered by Anthem, they are a credit-based insurance company that will help offset your medical and pharmacy costs. You do have access to in-network and out-of-network providers. You can get a flexible savings account to help offset any out-of-pocket costs. However, there are no copays. You only pay deductibles and co-insurance. And depending on your tier, because the HRA is tiered off into gold, silver, and bronze, that will dictate how high your deductible is. The gold plan, you will have a lower deductible. However, the silver plan, you will have a higher deductible and a lower premium, but the gold plan, you will have a higher premium. HDHP, which again is the high deductible health plan that is administered by United Healthcare. There are lower monthly premiums. You have access to in-network and out-of-network doctors. You also can get a health savings account to help offset any out-of-pocket costs. There are no copays associated with this plan. However, you have to meet deductibles and co-insurance, and these are higher deductibles with a lower monthly premium. The Anthem or United Care HMO, these plans are good for members who like predictable costs when visiting the doctor, have in-network physicians, and also good for those that want access to doctors nationwide. The Kaiser Regional HMO are good for members who do not like to meet deductibles, who will only be responsible for paying copays for any visits, and those that like to have all of their medical, pharmacy, and wellness services under one roof. Anthem HRA are good for those who want access to in-network and out-of-network doctors. You are given credits at the beginning of each plan year by SHBP. The gold level, you would pay a higher copay but a lower deductible. With the bronze plan, you will pay a lower monthly premium with a higher deductible. HDHP, which is United Healthcare, you have access to in-network and out-of-network doctors. You will save money on your premium. However, remember, it is a higher deductible that must be met before the insurance company pays their portion. So in this scenario, we're going to say that you have not visited the doctor at all for the plan year. Each scenario breaks down how the plan will process your doctor's visit. For the Anthem HMO, it is said that the negotiated rate for insurance and for a doctor's visit will be $125. So once you go to the doctor and they run your insurance, if you have the Anthem HMO, you will be responsible for a $35 copay. That $35 counts towards your out-of-pocket max, and that is with United and Anthem. The regional HMO, which is Kaiser, that is a copay only option. So when you go for a sick appointment, you will be responsible for a $35 copay before you're seen by the physician. For HRA, which is Anthem, this scenario, we're using the silver plan. That is the middle plan of the HRA options. Your deductible is $2,000. Your out-of-pocket max is $5,000. But SHBP has given you 200 credits, which are dollars, towards your plan. So your doctor's visit is $125. At your doctor's visit, you will not be responsible for paying any out-of-pocket costs because the value of that visit, which is $125, will be deducted from your 200 credits that you were given by SHBP for the plan year. That leaves you with the remainder of 75 credits for the rest of the year. But we will go over later in the presentation how you can earn additional credits to help offset any out-of-pocket costs. A good thing is that the $200 that is going to the $125 that you're paying for the sick appointment goes towards your deductible and your out-of-pocket cost. For the HDHP plan, since it is the high deductible health plan and for an employee only, the deductible is $3,500. Remember, you have to meet your deductible before the plan pays anything. So at the time of that sick appointment, which is a value of $125, you would have to pay $125 before you are seen by the physician. That $125 does decrease your deductible and out-of-pocket cost. For the second scenario, we're going to view outpatient surgery. For outpatient surgery, it has been deemed that it will cost $2,000 for the physician and the facility. This is before insurance is applied. For the statewide HMO, which again is Anthem and United Healthcare, you have a $1,300 deductible, a $4,000 out-of-pocket max with 20% co-insurance. So that means that you will pay the first $1,300, which is your deductible. You will pay 20% of the remaining balance. So that's $18,700 of the remaining, plus 20% of the co-insurance. After you have paid the $1,300 plus the $2,700, the rest of the year, the insurance company will cover you at 100%. For the regional HMO, which is Kaiser, since they are copay only, you will be responsible for paying a $100 copay before you receive the service. The $100 copay goes towards your out-of-pocket max. The Anthem HRA, in this scenario, we are using the silver plan again. The deductible is $2,000. Your out-of-pocket max is $5,000, and you are given the 200 credits by SHBP. So in this scenario, you have not used the 200 credits, nor have you paid anything towards your deductible or out-of-pocket max. This means that you will be responsible for the $2,000 deductible and 20% of the remaining balance of $18,000. Since your out-of-pocket max is $5,000, you would only pay the $2,000 and the 20% of the copay, but your maximum amount for this $20,000 surgery will be $5,000. So you would basically pay your out-of-pocket max. The remainder of the year, everything else is covered at 100%. For the HDHP plan, this is the high deductible health plan. Again, before any amount of money is paid by the insurance company, you have to meet the deductible. So you will be responsible for the $3,500 deductible. They have 30% co-insurance. So the $3,500 deductible would decrease the amount that you have to pay. So it's $16,500 is the 30% of the copay, which is $4,950. So you would pay your out-of-pocket max of $6,450. After that, everything else is covered. So a quick recap for the Anthem HMO and HRA. For the HMO, you have co-pays, co-insurance, deductibles. All preventative care is covered at 100%. Your medical and pharmacy costs count towards your out-of-pocket max. There are no referrals needed for specialists. You can earn incentive credits. They do participate in the disease management program, and your credits can roll over from year to year. The HRA plan, that is gold, silver, and bronze, you have co-insurance, deductibles, 100% for preventative care. Your medical and pharmacy costs count towards your out-of-pocket max. You have access to in-network and out-of-network physicians. There are no referrals needed for specialists. The plan does come with preloaded SHBP credits. You can earn additional credits. They also participate in a disease management program, and your credits can roll over from year to year. United Healthcare, HMO, and HDHP. With the HMO, you have copays, co-insurance, deductible, preventative care is covered at 100%. Your medical and pharmacy costs count towards out-of-pocket max. There are no referrals necessary for specialists. You can earn incentive credits. They do participate in a disease management program, and credits do roll over from year to year. For the HDHP plan, you have co-insurance, deductibles. Preventative care is covered at 100%. Your medical and pharmacy costs count towards out-of-pocket max. You have access to in-network and out-of-network doctors. There are no referrals needed for specialists. You can earn incentive credits. However, in order to use your incentive credits, you must have already met your deductible. They do participate in a disease management program, and credits can roll over from year to year. With Kaiser Regional HMO, they only have copays. Again, you must live or work within the 27 metro Atlanta counties. Preventative care is covered at 100%. Your medical and pharmacy costs count towards your out-of-pocket max. No referrals needed for specialists. However, referrals will be needed for certain specialists. You earn a reward card with Kaiser, and credits do not roll over from year to year unless you were previously enrolled in another SHBP option before you selected Kaiser. If you are planning to retire, please have health insurance 1 year prior to your retirement. So if your retirement date is January 1 and you have not had health insurance for the previous plan year, please make sure you sign up for health insurance during open enrollment of that year before you retire. For the 2021 plan year, if you choose Anthem or United Healthcare, to get your prescriptions filled, they have partnered with CVS Caremark. This does not mean that you have to go to a CVS to get your prescriptions filled. You can still go to your preferred pharmacy and have all of your other benefits. CVS just promises to not have you pay a high amount for prescriptions. If you choose Kaiser, Kaiser is the administrator of their prescriptions and refills. However, you are not required to get your prescription filled at Kaiser. However, if you do choose to go to a pharmacy outside of Kaiser, you are subject to the full cost of your prescription. What is a wellness incentive? Wellness incentives from Anthem and United Healthcare help offset your co-pays, co-insurance, and deductibles. How do you earn your wellness incentives? Well, in order to earn your 2021 wellness incentives, you have activities that you must participate in. How do you earn your wellness incentives? Well, first, you would do a real age test. This questionnaire takes about 15 minutes, and it will ask you questions like how much physical activity do you get in a week? How many vegetables do you eat in a week? How much water do you drink? After you have completed this, at the end, you would like for it to say your internal body is younger than the years that you have been here on Earth. After that completion, you will have earned 120 wellness incentive points. To earn the next 120 wellness incentive points, you will do a biometric screening. You can either do it through your own physician by printing out a preloaded form from your Be Well SHBP site, or you can go to a Quest Diagnostic Patient Center and have all of your blood work done there. Or last but not least, there are some SHBP sponsored screening events throughout the state. After you have completed your biometric screening, you would have earned an additional 120 wellness incentive points. To earn the remaining 240 points that is available to you and a covered spouse, you have to do one of two things. You can either set up a telephone coaching call where you are required to do at least 4 throughout the year, or you can participate into the online pathway or challenges. The online pathway or challenges can be found within your Be Well SHBP website. And the telephone coaching calls you will set up with SHBP by calling 1-800-610-1863 and following the prompts to the telephone coaching calls. Again, you only have to do 4, but you can exceed that amount if you would like. The telephone coaching calls can be something as simple as you would like to increase your water intake for the 2021 year. You will give them ways that you have implemented the increase, and they will give you suggestions as well. After you have completed either 4 of the telephone coaching calls or 2 of the pathway or challenges, you will receive the remaining 240 credits. After you have received your entire 480 credits, you can choose to do one of 3 things. You can either choose to exchange your entire 480 credits for a $150 Visa gift card that can be used anywhere Visa is accepted. Or you can choose to switch the 480 credits into a $225 Walmart gift card that can only be used at Walmart's pharmacy or vision center. Or you can opt to roll the entire 480 credits over into your health spending account balance. So this is where it will help offset your copays, coinsurance, and deductibles. It works a little bit differently with HMO and HRA. With the 480 credits with the HMO, if you pay a deductible with either your debit card or a credit card, Anthem or United Healthcare will see that you have wellness incentive points, and they will send you a $35 check for the copay that you had to pay for the doctor. Or if you had to get a prescription filled, they will send you the cost of your out-of-pocket cost of the prescription. However, with the HRA, it will add to your upfront credits that you get from SHBP. So this will help offset any out-of-pocket costs that you may incur from the doctor or the pharmacy. And this should be only applied to sick appointments for the doctor, and for the pharmacy is for any out-of-pocket costs that you may incur that is not covered by the insurance. Kaiser has their own wellness incentives for their members. In order to participate in the wellness incentives with Kaiser, you have to do their version of the real age test. You will also have to know your numbers by getting your biometric screening or your physical. They also require for you to get age-appropriate cancer screenings and to participate in an online health lifestyle program. This is available to you and your covered spouse. You can earn a $500 MasterCard gift card that can be used anywhere MasterCard is available. Again, this is available to you and a covered spouse. We also offer TRICARE supplemental plan for military members. You must have your DEARS number when you sign up. Peach Care for Kids is offered to state employees. This is up to children age 19. If this is something that you're interested in, please go to the Department of Community Health and fill out their application. They are the determining factor if you are approved or not. Here are a few helpful contacts. Also, again, if you have any problems getting into the SHBP portal, please contact myself or SHBP. Remember that if you are covering any dependents, whether that be a spouse or a child, they will be put in a pending process. So if they're put in the pending process, you will receive something from ADP Dependent Verification via mail. Please open it and process as soon as possible because it is deadline sensitive. For dependents, it usually asks for something like your birth certificate. For a spouse, I think the most common is your marriage certificate. You as the employee are automatically approved for health insurance, but anyone outside of yourself will be pending. So please, please, please look at your deadlines. If they have not received the information by the deadline, your dependents will be dropped. Now we will go over the 2021 flexible benefit options. To make your online elections for your flexible benefits, please visit gabreeze.ga.gov. You will click the Are You a New User link. It will ask you the last four of your social and your birthday. After you have inputted that information, please enter all password retrieval options, whether it be entering a phone number or email address, and please set up your security questions and your phone PIN number. This will help you access the website for future use. For the 2021 plan year, your flexible benefit options are Cigna and Delta Dental for your dental insurance, WageWorks for your healthcare and dependent care account. MetLife is the administrator of all life insurance policies, And now our legal plan as well. Unum, long-term care. The standard, short-term and long-term disability. Aflac, critical illness. And last but not least, we have Anthem Blue View Vision for your vision insurance. So dental insurance that is administered by Cigna and Delta Dental. Delta Dental is our PPO plan that is offered throughout the state of Georgia. We have a Select and Select Plus plan. With the Select plan, there is a maximum $500 coverage for the year. With the Select Plus plan, there's a $200 maximum coverage for the year. However, with both plans, there is a 6-month waiting period on major services. You are able to go in and get your cleanings and x-rays at no charge, but at the time of your cleaning, it is deemed that you need a root canal or a cavity fill. The insurance plan will not cover its portion until after the 6-month waiting period. With the Select Plus plan, they have an additional amenity that is a $2,000 lifetime contribution to you and any covered dependents towards orthodontia work. With the Cigna, that is a DHMO plan. There are no maximum coverage amounts for the year. There are no waiting periods associated with this plan. However, it is limited to the Metro Atlanta area. Anthem Blue View Vision is the vision insurance. It has a Select and Select Plus plans. The copays differ in both plans, and I think one of the most prominent differences in both plans, with the Select plan, you are given a $130 allowance towards the cost of frames twice every 2 years. There is 20% off the remaining retail balance. With the Select Plus plan, you are given a $150 cost towards the cost of frames every year, with 20% off of the remaining balance. MetLife is the administrator of all life insurance policies. For employee life, we offer 1 to 10 times your salary with a maximum coverage of $2 million. As a new hire, you are given the one-time opportunity to choose designated levels of insurance as a new hire before you have to provide medical underwriting. Coverage amount for one time up to $200,000 is guaranteed. Also associated with the life insurance, you have premium waivers if you become disabled. They do also allow you to do a will preparation. They will partner with Hyatt Legal to help you complete a will, living will, or power of attorney for you and your legal spouse at no charge. They also have estate resolution services. This gives your beneficiaries the support of, again, Hyatt Legal if they have problems with your estate. These are in person or via telephone visits. Again, for employee life, it is 1 to 10 times your salary. Spouse life is up to $250,000, and child life, $20,000. Accidental death and dismemberment, this is 1 to 10 times your salary as well, with a max coverage amount of $2 million. If this is something you are looking into, you will have to complete the statement of health online. This will be done after you have completed your Georgia Breeze enrollment. The Standard is the administrator of the short-term and disability insurance. For short-term disability, this is a 6-month disability plan that will pay you on a weekly basis. It is not for a permanent period of time. It will replace 60% of your salary on a weekly basis. There is a 7-day and a 30-day waiting period. The maximum amount of money each week that an employee can earn from short-term disability is $1,000. For long-term disability, you have to be out of work for at least 6 months or 180 plus days to be eligible. This only kicks in, again, after you have been out for 6 months. If you enroll as a new hire, you will not be considered a late enrollee. If this is an option that you are thinking about signing up for later during open enrollment, you will be considered a late enrollee. Saying that if you become disabled, and even if you chose a 7-day waiting period, and you didn't sign up for short-term disability when you became employed with the state, you will have to wait 60 days before your disability insurance pays you, even if you only chose a 7-day waiting period. If you do not sign up for long-term disability as a new hire, you will not have the option for it after being a new hire. Specified illness through AFLAC, we have coverage for employees and spouses, both up to $50,000. If you get specified illness for yourself, your children are covered at 50% at no cost. For the specified illness, if you have a heart attack and you chose the $50,000 coverage level for your heart attack, you will receive a check for $50,000. If you have another heart attack at least 12 months past the first one, you will only get half of the value of your coverage level. So again, if you chose the $50,000, your check will only be for $25,000. Long-term care administered by Unum. What is long-term care? This is care that you, your spouse, your parents, or your parents-in-law have access to help you with your day-to-day living. This can help you with bathing, dressing, going to the bathroom, eating, and if you suffer from cognitive impairment such as Alzheimer's. Again, you, your spouse, your parents, and your parents-in-laws are covered. If this is something that you're interested in for yourself, it can be payroll deducted. However, if you're interested in anyone other than yourself, such as a family member, you will be direct billed by Unum and you will pay Unum directly. In your Georgia Breeze enrollment portal, you will not see a link for you to sign up for Unum. Please visit unuminfo.com/SOG to get your rate calculator and the enrollment portal. For your legal insurance, MetLife Legal Plans is the administrator. You have Select, Select Plus, and Select Premium options. If you choose a Select Premium option, you will have all options under Select Premium as well as Select and Select Plus plan. If you choose Select Plus, you have all options under Select Plus and the Select plan. However, if you just choose the Select plan, you only have the options available under the Select plan. This is a nationwide benefit that is available to you 24 hours a day, 7 days a week. For your flexible spending accounts, WageWorks is the administrator. For the healthcare spending account, the annual max is now $2,700. The healthcare spending account is an account where you would designate an annual amount to contribute, and this could help offset deductibles, copays, prescription costs, physical therapy, and contact lenses and glasses. Whatever amount you decide to select for the year is available to you on the effective date of your benefits. So if your start date is on the 1st of the month and you select the healthcare spending account, whatever amount you selected is readily available to you the 1st of the next month. Please make sure you retain all receipts because sometimes WageWorks will require a copy. For the dependent care spending account, the annual max amount is $4,992. This is a little bit different than the healthcare spending account. This service is a pay up front and get reimbursed later. And with the dependent care account, it can help offset your after school costs or daycare costs. You would pay your provider upfront, receive a receipt, and then upload that receipt into your WageWorks account. Once you have reached the amount on your receipt, you will receive a check in the mail for the amount of that receipt paying back to you. You will not be reimbursed for any expenses until you have that amount in your account. So on the 24th of each month, which is a pay period, the 1st through the 15th, you will see deducted from your check ERS, 401k, if you choose healthcare dependent care spending accounts, and health insurance premiums. The reason that you see the healthcare and dependent care accounts is because, remember, we talked about putting the monthly amount. This will automatically split it up into 2 payments that you will see on the 24th and your 9th check. There's also a $3.20 administrative fee that is also split in half that's added to your premium amount. On the 9th of the month, you will see deducted from your paycheck your ERS, your 401k deductions, if you choose a healthcare dependent care spending account, all other flexible benefit premiums, and anyone who works in the Go office, your parking. These are a few numbers associated with each insurance company. Again, I am Monique Horton. I'm the benefits coordinator here. If you have any questions, please feel free to give me a call at 404-631-1505, or I can be reached via email at mhorton@dot.ga.gov. Welcome to GDOT.